This is the 9th of 17 forums around the state we're holding as part of this heroin and opioid task force. The mission of the task force is to have a report due about June 1st, and then subsequent legislation before session ends this year to combat this statewide epidemic. We've gotten some great testimony and feedback interaction over the last several of our forums, and we look forward to hearing from our witnesses today and getting some good ideas. Obviously, as Senator Golden probably mentioned, we're focusing on prevention, treatment, and law enforcement. So any of you, if you, through your expertise, whether it's in any of those areas, thinking outside the box, what has worked, what do you not think will work, and if you ever thought there ought to be a law, this is the time to talk about it. So thank you, and I appreciate being here. Thank you.
I think the message that the medical community and the dental community needs to hear is very similar to the message that the public needs to hear, which is that these pills are essentially heroin pills. If young people understood when they're experimenting with drugs that this is not a soft drug, that this is a hard drug that could kill them, that can alter the rest of their life through addiction, if they understood that, they might be less likely to experiment with painkillers. But again, I think the real answer boils down to not exposing such a large percentage of our population to a highly addictive drug, and that's where prescribers come into play.
I want to go over to Mr. McGoldrick. Looking at what we're hearing between the communities across Brooklyn and across the city of New York, across the state of New York. Unfortunately, I get killed in my own community when I say this, but it's true. Brooklyn is the capital of Medicaid fraud, Medicare fraud, welfare fraud, insurance, car insurance fraud, and we're moving into number one into two other areas, and that's drug diversion, and it seems to be heroin death and overdose and death. Since we have concentrated areas, we know that we are the capital of in the nation on a number of these different issues. Isn't there a way of coming in here and going and looking at these points across the state, putting efforts into overlays, technology overlays, and understanding not just where these frauds are going, but specifically in the drug diversion and specifically in the pain doctors and specifically in the doctors that are selling or moving these prescriptions and the pharmacies that are selling these? Can you help me out on that one?
Yes, thank you, Senator Boyle and Senators Nolozio and Golden for the opportunity to speak to you today. I'm an attorney with 32 years experience.
Pull the mic closer to you, please.
I'm an attorney with 32 years experience in New York State, but I'm also a retired detective sergeant from the New York State Police. For the last 20 years, I've been providing Medicaid fraud investigative and audit services to the United States Health and Human Services, Center for Medicaid and Medicare Services, New York State Department of Social Services, New York State Department of Health, New York State New York State Office of Medicaid Inspector General, and New York City HRA. I'm accompanied here today by a confidential consultant who is a retired NYPD narcotics detective who has worked with me throughout those 20 years in a very specific area. We will refer to him as the detective. He is an expert in drug diversion. Our efforts have been focused in that area for the state of New York. The doctors who spoke this morning very well established the proposition that pills and heroin are hand in hand. The supply of pills that comes into the problem, that creates the problem, comes from the medicine cabinet, which education and awareness is a key. The detective actually this morning over coffee said, why don't the senators talk about having a piece of paper handed to people with the prescription and say, don't keep this in your medicine cabinet. You know, think Eddie Haskell coming to visit your house and asking to use the bathroom. When he knows the pills are worth $40 a piece, what's he going to do? You know, he's going to visit everybody's bathroom. So, as the detective was saying, that's a very quick fix maybe, a little piece of paper. Find a secure place to put this. That's number one. Number two, for years, I've been trying to get a straight answer on why we can't get a better disposal method. You know, in the old days, they used to flush it. It's dangerous stuff, but it's dangerous for the environment. Now people don't know where the recovery centers are, and people are not going to get on in their car or in the subway and go to some disposal center to get rid of the stuff. So that's one supply, the medicine cabinet. The AMA seems to think that 70% of the illicit trade, the stuff that's on the street that's being abused, is coming out of the medicine cabinet. I don't believe that. I believe that the majority of the illicit painkiller pills that are causing the problem now are coming out of drug diversion. And I have a crystal clear example of that, and it's in the form of 2 federal cases within 18 months. The United States
If you can, when you're doing that drug diversion, determine also see how that leads into heroin.
Right, and they're hand in hand, obviously, from what the doctor said. The United States Attorney for the Southern District of New York, Preet Bharara, and it's in the package I gave you, announced 2 federal cases, one in July of 2012 and one only 2 months ago. And in both cases, the New York State Medicaid program, inadvertently and through fraud, supplied $500 million worth of pills in each case. So it's $1 billion worth of prescription painkiller pills that hit the street because the New York State Medicaid system was being defrauded. Now, Social Services, Health Department, and Medicaid Inspector General, all those years, there have been successive contracts for Medicaid fraud investigators. And basically, they're retired members of NYPD, multi-ethnic, and they get out and they investigate the bad doctors. And the detective can tell you in a moment that that's actually a very fruitful way to do it. You get the word off the street. You know, where do I go to get a prescription for Percocet or something like that? And it's a very direct way of dealing with it. These are licensed professionals. Unlike heroin, which is coming across the borders from many different countries, diversion of prescription painkiller pills involves professionals. There are pharmacies and doctors. It's a closed system, so you can take steps. Every bad doctor that you kick out of the system who's prescribing $1 million worth of this stuff a year is going to save lives and save the state $1 million.
The doctor pointed out earlier this morning about how they were diversion, especially in these, let's say the pain health centers. Is there a way that we can do technology overlays to find out which health centers are doing the prescriptions, and once you can find out who the addicted and how they're going into heroin and where the heroin's coming in, and how is the heroin coming into Brooklyn?
The New York State Department of Health and the New York State Medicaid Inspector General and the New York State Attorney General have access to the MMIS system, which is the Medicaid Management Information System, and the Fraud and Abuse Management System that sits on top of that. That's an IBM product. They can search for every prescription and patterns of prescriptions that were written. You can look for the doctor in the Bronx who's overprescribing and his stuff is all being filled in Suffolk, which is an actual case. They can look for a pediatrician who maybe somebody stole his pad. All of a sudden, this pediatrician is ordering oxycodone. They've got all these filters and edits that they can do. But they need the staff. Up until September 30th, 2011, there was 60 people working on this kind of stuff on outsourced contracts. Those contracts ended at the end of September. Within 10 months, the federal U.S. attorney had his first $500 million case. There was a limbo period where those contracts didn't exist at all, and at the end of that period, when they just started to come up again, there was the other $500 million case. Instead of 60 people, they've got 6. So that's something that, you know, the senators can address. It's going back to OMIG and find out why that contract, or there's 3 of them, why aren't they being used? They're contracts for auditors, nurses, computer people, and investigators. I don't know if it's for lack of funding. If it is for lack of funding, I can tell you this. For 20 years, it's been calculated that it returns at least 10 to 1 on the money. So if it's $5 million a year, they're saving 50.